Hi, I'm Dr. Joe Alaimo of Nutrimost Wilmington. Today we're going to talk about the body composition analysis, which is one of the first steps that we do before we start anybody on a program. We refer to it in the office as a BCA, and again it stands for body composition analysis. Most people think it's a scale because you do step on something that resembles a scale. However, it's got a computerized program that analyzes a lot of other factors. One of the things it looks at obviously is your weight. That's what most people are concerned of. Second thing we look at is BMI. BMI is your body mass index, and basically it needs to be under 30. Once it goes over 30, it will increase your chance for cardiovascular disease, heart attack, stroke, even cancer. And this is according to the government, it's not according to our program. So we want to get BMI under 30. That's basically your height and weight on a scale. So if you're 6'2" and 200, it's different than if you're 5'2" and 200. So that's basically what that number means. We also look at body fat percentage. We got to get the body fat percentage into a good safe zone based on your height, your weight, and your age. Body fat mass is the actual fat that you have in pounds. So you might be 50% body fat at 200 pounds, and that would mean 100 pounds of fat. It does not mean that you need to lose 100 pounds of fat, because we need some fat in our bodies. But it gives us the actual number. The next one is real important, especially as a physician. One of the most important numbers I look for is the visceral fat. That's the fat in here around your organs. If you have too much fat around your liver, your heart, it's going to force those organs to work differently than what they were designed to do. So we want to make sure visceral fat stays below 12. Again, once it goes over 12, it will increase your chance for heart attack, stroke, cardiovascular disease, cancer. The next thing we look at is body water percentage. Really important because 99% of my patients are dehydrated. And you can be dehydrated for a couple reasons. The number one reason we see is patients are not drinking enough water. Number two reason is you don't have enough minerals in your body. Minerals are what allow your body to actually pull that water and suck it into the cell. We want the cells to look like big plump grapes, not shriveled up like raisins. So that's really important. And again, most of my patients are dehydrated. We look at body water mass, and that's again pounds in water. We look at that. The last thing we look at is metabolic age. Metabolic age is how fast your body's breaking down food. So if you're 25, your metabolic age should be 25. If you're 25 and your metabolic age is 75, this usually comes from yo-yo dieting and people just screwing up their metabolisms. So what we want to do is get the metabolic age closer to your real age. Because what that means is even if you cut out calories and go to the gym every day, if your body's breaking down food slower than it needs to or than it's supposed to, then you're never going to lose weight. So what we want to do is make sure that metabolic age speeds up and gets closer to your real age. We got to work on the metabolism. Because if you don't fix that, the weight will never stay off long term. So again, this was the body composition analysis. First step in getting an analysis with our office, and this is our starting point. We do this on a weekly basis to monitor your progress, make sure you're losing fat and not water. So if you have any questions, hit me with a private message or just call the office, 251-1620. Thanks and have a great day.